Hi, folks, it's Dr. Christine again, and today I want to talk about bariatric surgery and the rate of healthcare use after bariatric surgery in teens. Now, bariatric surgery or weight loss surgery is known to have complication and should be reserved to the most serious cases. It's not an easy way out. That said, if you're more than 100 pounds overweight, it's certainly worth thinking about. I myself had gastric bypass surgery actually in India in 2006, which led to my initial weight loss. Now, bariatric surgery, gastric bypass, the sleeve, whatever you have done, it's not an easy way out, and most people gain the weight back afterwards because it's not that you can't eat afterwards, and it's not an easy way out. It's a tool like other tools. It can be okay, but there's stringent requirements afterwards, as well as it comes to nutrition, as to vitamin substitution for the rest of your life. That said, let's look at that study here. In teens, now that is a problem. On the other hand, I can understand that teens want to have gastric bypass or sleeve surgery when they are desperate to lose weight because they get a lot of pushback because there's discriminations against really big people. I have experienced that. Now, healthcare use, they followed them 5 years about emergency department use and hospitalization. Now, that doesn't mean they're healthy and happy. It just means they're not so sick that they land in the hospital, which is a problem. And yes, they have complication rates when they're untreated too. So it's a two-sided sword. And in my opinion, every young person that's overweight needs to think about what is his or her best option and about the consequences for beyond 5 years. Alrighty, I had my gastric bypass now for 16 years and kept the weight off, nearly all 150 pounds, which is not an easy feat. You have to look at it and work at it. And that's why I'm doing what I'm doing. And I'm passionate about helping people to lose weight, at least to try it consistently in a natural way, which is possible even for young people. And my focus is actually on families so they can eat together. And for young people, when it starts in childhood, it can be a big problem later on because the fat cells that are grown in the body, they always want to gain weight later on. And even a sleeve gastrectomy or gastric bypass will not change that tendency. And often it will not solve the emotional problems that those young people face. It is a very complex approach, and believe me, I know what I'm talking about. Now, that said, let's look back at the study. They both need to significant is defined mostly as 10% of body weight, which if you are 300 pounds, it's 30 pounds. It's not really highly significant. For me, I was 320 pounds. I lost 150. I lost half of my body. That's an unusual result because I was very motivated and I kept most of it off. Now, that said, it is possible. 18 years old they were, three-quarters were female. Sleeve gastrectomy became more common. They don't say why, okay. Increased to 82%. It's probably an easier procedure. It's less invasive when it comes to the anatomy. I personally think it's not as effective in the long term, but that is my impression from what I've seen. Now, the emergency department use sleeve gastrectomy was 53%, gastric bypass 59%. That's probably not significant. Hospitalization rate, that was significant. Now, they didn't say when it was and what it was. That's a problem because the complication and reoperation wasn't different. Okay, reoperation, about the same complications, a little higher in the gastric bypass. There was even a death in the sleeve gastrectomy in a healthy 18, well, in an overweight 18-year-old. Now, it can happen. We don't know the circumstances. Certainly, if somebody weighs 600 pounds, their risk of death is very high, whether they have surgery or not. So I'm not criticizing that. Revision had to be done in both ways. Okay, the caution. Yeah, patient characteristic. Of course, it may and it's a small sample size, and they actually appreciate that it is. And in my opinion, the follow-up time of only 5 years is not long enough. For 18-year-old people, it's nice to do that, but it's not long enough to really compare those procedures. I hope everything goes well for you when you're watching that. If you're a young person, if you're a mother, if you have kids, if you ever want to talk to me, please feel free to. Underneath the video is a link, and you can book a free call with me. I'm happy to talk to you about you and your family or your loved ones' weight loss journey. Bye bye.